Hi everyone, my name is Dr. Hilary Booth and I'm a naturopathic doctor, and welcome to my video blog. As promised, this week I'm going to be giving you my tips for promoting fertility. If you didn't already watch my video last week, I would recommend that you do so now. The video gives you lots of information about your risk about infertility, but the biggest take-home message is this, that 1 in 6 Canadian couples ages 18 through 44 are given a diagnosis of infertility, and this number terrifies me. So today I'm going to be giving you my top 5 tips for boosting and promoting your future fertility. Tip number 1 is to make sure that your nutrition is fertility boosting. So make sure that you're getting enough fats. 25 to 35% of your caloric intake every day should be coming from fat. Great sources include avocado, chia, flax, nuts, seeds, olive oil, and coconut oil. Basically, you can also nix those low-fat dairy options. You can go for the 2% fat dairy options if dairy isn't a problem with your body. Secondly, you should be replacing some of your animal proteins with plant proteins. So good sources of plant protein include beans, lentils, hemp, quinoa, and nuts, and this will actually increase your fertility by 50% just by replacing some of those animal proteins with plant proteins. Not all of them, but some. Next, you need to load up on omega-3s. Fish, especially salmon and sardines, are wonderful, but also chia and flax are great sources of omega-3s. Omega-3s are powerful because they are a part of every single cell in our bodies, and research shows that they improve pregnancy rates, they reduce miscarriage, and they reduce the risk of premature birth. My number 2 tip for you is to identify hormone imbalances and get those treated as soon as possible. So how do you know if you have hormone imbalances or if you're even ovulating? If you don't want to get pregnant right now, this may not be something that you're thinking about. But if you've been on the hormonal birth control, whether that's the pill, the patch, the ring, whatever, for more than 10 years, it's time to start thinking about coming off of that birth control. Now, basically, it can take your body up to 1 year to start regulating its own hormones again and to start ovulating naturally. And I recommend that you talk to your doctor about going off the pill, patch, whatever you're on, at least 1 year before you plan to conceive. And this allows your body time to regulate itself and bring those hormone balances back into place. Now, the other thing is that the pill can mask underlying hormonal issues. So if you've been on the pill, for example, since your late teens or early 20s, you may not know that you've developed one of these hormonal conditions like PCOS or endometriosis or fibroids, and the pill is masking these things. So you need to come off of it to know whether this needs to be treated long before you think about getting pregnant. Now, if you're not on birth control, I would encourage you to take a good hard look at your period. Your period's a great indicator of what your hormones are doing in your body. Is it clotted? Is it exceptionally heavy? Is it really light? Is it irregular? Is there a lot of pain with it? Do you get a lot of PMS symptoms? All these things can tell us what type of hormone imbalances that you may have, and these need to be corrected, again, because they can cause infertility. Now, watch my video on the perfect period for more information about this. My number 3 tip for you is to keep in mind your eggs. So your egg number and your egg quality are what we're looking at here. Your eggs are, you're given a specific finite number of eggs in your ovaries at birth. And from the time of puberty through till menopause, you have this finite number of eggs that you can ovulate in order to possibly have a baby. Now, if you're over 36, women start experiencing a decline in these number of eggs. And as these numbers decline, so do their quality. This is why as our number of eggs are depleted, it increases our risk of infertility, of miscarriage, of complications in pregnancy, and of birth defects. So as a naturopathic doctor, we want to do everything that we can to support this egg quality for as long as possible. In order to do this, we give something called PQQ and CoQ10, and these guys both support mitochondrial functioning to give those eggs kind of a longer shelf life, if you will. The other most important thing to take away from this about understanding the quality and number of your eggs is that you can prevent this by considering having a baby a little bit younger. This is a little bit of a taboo thing, I know, but I'm going to go ahead and say it anyway. please think about having children before the age of 36, where after 36 we really start to see infertility rates increase a lot. My next tip is that you can change up your lifestyle. First of all, you can ensure that you're the proper body weight and fat percentage. This means having a BMI between 20 and 25 and a body fat percent between 22 and 32. You can get your body fat percent tested at a naturopathic doctor or some health fitness studios, and your BMI, you can just Google BMI calculators online and you can do that at home. So if you are underweight and you don't have enough body fat, this means your body isn't able to produce enough hormones to actually carry a pregnancy, and this is a major cause of infertility. Think about it, your primal body thinks that you're under a famine, and it prevents you from being able to carry a pregnancy because your body doesn't have enough resources to actually provide to a growing baby. On the other end of the scale, if you are overweight, this is another problem because fat cells produce estrogen, and this can cause hormonal imbalances that can prevent you from being able to get pregnant. Also, being overweight can mean that you have insulin resistance, and insulin resistance can also cause infertility. What's the bottom line here? Start working to achieve a healthy body weight now, and this can increase your increase your fertility rate by 43%. Next is alcohol. Alcohol increases your body's age, but it also increases your reproductive age. Now, one drink during any cycle can decrease your chances of getting pregnant on that cycle by 50%. This is not to be used as a birth control method, but obviously if you are looking to get pregnant, this can have profound impacts on you. If you want to stay fertile for longer, ladies, this means less than 4 drinks per week and no more than 1 drink in a sitting. Next is caffeine. Cut down your caffeine and take to 1 cup of coffee or caffeinated tea per day. And if you're looking for that afternoon fix and you're having trouble with cutting back, I'd recommend switching to half decaf or a green tea and sort of weaning yourself down from there. Women drinking coffee have 3 times more difficulty getting pregnant than women not drinking coffee. And my last and final tip, tip number 5, is my most important one. This is dealing with underlying medical conditions before it's too late. Underlying medical conditions are the primary cause of infertility. So making sure that you're getting regular blood work done with your doctor, you're getting Pap screens and STI testing. Make sure that you're getting all these conditions looked at and monitoring your health as you age to ensure that you aren't developing any concerns and catching things and treating them before it's too late. If you have fibroids, endometriosis, PCOS, ovarian cyst, digestive disturbances like IBS or Crohn's and colitis, if you have sexually transmitted infections, if you have a thyroid condition, you need to get these things under wraps before you can consider trying to have a baby, because they can cause and they can decrease your likelihood of being able to get pregnant, and they can take a long time to treat and get under wraps. So if you're unsure about whether or not you have any of these conditions, I would recommend speaking with your naturopathic doctor, and they can give you a proper diagnosis if you need one. The other tricky piece of this puzzle is that, unfortunately, MDs, a lot of times when faced with a hormonal imbalance like fibroids or endometriosis or PCOS or any sort of period concerns that you might have, unfortunately, they're really one of their only tools is to put you on the birth control pill. And we've already chatted a little bit about how that can affect your fertility in the long term, and this really is an effective tool of promoting your fertility for you. As a naturopathic doctor, though, we can successfully treat these conditions by treating the underlying cause of them without the use of the birth control pill or unnecessary surgeries. This will allow you to become more fertile and more fertile for longer, increasing the likelihood that you can get pregnant when you want to, and that you won't be one of that terrifying statistic of 1 in 6 couples in Canada who have a diagnosis of infertility. So I hope you learned something today, even just a couple tips from this video to help improve your fertility over the long term. If you have any questions about this or do have concerns, please book an appointment with me at the website or the phone number listed below. Thanks so much for watching, everybody. Please share this video and start a conversation about infertility. Thanks so much. Take care.